Well, let's look at the blood vessels of the upper limb of the human body. The handout we're using is from the coloring book, the anatomy coloring book, and on a single page, page 109, is a diagram of both the arteries and the veins. We'll start with the arteries because we know that typically when we study the arteries, then we know the majority of the veins that we need to learn. It's going to be a little bit different here, but we are going to limit the number of veins that we have. So that should work out nicely. So let's begin with the arteries. So we'll start up in the thoracic area, up right above the chest. And the first thing that we want to note is these are the blood vessels that are coming almost directly out of the heart. A major artery coming out of the heart called the aorta has a branch that leads to the right, and it moves up through the rib cage and up into the lower neck area, this lower cervical area. And the first artery that we see is the branch off the aorta called the brachiocephalic artery. Now, what does that term mean? Brachio is our term for arm, so the brachiocephalic is going to have two branches, one branch leading toward the shoulder and ultimately to the arm. And the cephalic term, of course, means head. So you can see that this brachiocephalic artery is named for the fact that it has two branches off of it, one leading to the head and one toward the arm. The branch toward the arm is called the subclavian, and again, that name means something. So the sub term typically means under, like a submarine goes underwater, and the clavian is a variation of the clavicle. So this is arching through the lower cervical area under the clavicle, and here's the clavicle in the picture. And so it's arching under that and now proceeding down into the lower part of the shoulder. The subclavian leads to a portion of the same tube called the axillary artery, and of course you and I know that means armpit. So the axillary artery is passing down and then into the medial side of the arm. The subclavian to the axillary is a single tube, and even as it goes on into the upper part of the arm, into the brachium, it is a single tube. It's just certain landmarks are going to cause it to change names. So our first three are these, and you see those here. Let's follow these now down into the brachium. And of course, the artery then down through the major part of the upper arm is the brachial artery. And as you approach the cubital area, the elbow area, it's going to divide into two. And since we know there are two bones in the forearm, these are going to be, of course, the radial artery to the lateral side and the ulnar artery to the medial side. So here's the basic layout. Every student that wants to know the names of these blood vessels is going to start with these details. The subclavian to the axillary to the brachial, and then dividing into the two major arteries in the forearm. So many of these arteries have branches on them, and you can see that in the outline of the handout. So let's go back up to the shoulder, okay? And right here, remember we colored in these major ones, brachiocephalic, subclavian, axillary. And here are the branches from that. The axillary artery has several branches from it. The names here are going to follow some of the bone features. So if you know the acromion process is that point of your shoulder It's the sort of the distal, or not so much distal, but lateral end of the scapula. And here's an artery that comes from the axillary and wraps around that area. Thoracoacromial, you don't have to worry about the branches part of that. Let's just make sure we could name that thoracoacromial, and it's got a thoraco in the name because you can see there is a branch that is leading toward the thoracic area. And in fact, there are a couple of arteries here that also carry the thoracic name, the C1 and the C3 arteries, and you see them in the picture here where I've circled that. The subscapular also is down below because that's going to lead posteriorly and behind the rib cage and to the deep side of the scapula. So we have a superior thoracic, the one of the C1 and C3. It's the upper one. The C3 is lower and it's lateral. And then you can see, and this is similar to what we studied in the femur, here is the circumflex humeral. Maybe you remember there was a circumflex femoral when we studied the lower limb, and here's an artery that makes a loop around the humerus. I think it's noteworthy that this is one of the few humeral objects that we find. Almost every object in the upper arm is going to carry the brachial term. And of course, if you had to guess, that would be any object in that upper part of the arm. If you're going to name it, it's going to be named brachial. This is one of the few exceptions here. So here are 1, 2, 3, 4, 5 arteries in and around the axillary artery that you should be able to name. Let's move further down now in just a moment. And let's now look in the brachial area. Here's the brachial, the radial, and the ulnar. So we'll color those in. And notice there are a number of arteries now running parallel to the brachial. There's one on the lateral side, and it's really the profunda brachii. If you see that little D1, that's the deep brachial artery. And again, so many parallels to the lower limb. We had a femoral artery and a profunda femoris. Here's the brachial artery and the profunda brachii, and it runs to the lateral side. And then on the medial side, we have two. So there's single artery running parallel down the lateral side of the brachium. And then here we have two arteries running down the medial side. And the designation here, calling them ulnar, is giving you that concept that they're on the medial side. The collateral term here is referring to the fact that these are running beside or parallel to the brachial artery. So the profunda brachii on the lateral side and these two ulnar collaterals on the medial side. And how do you tell them apart? One's superior and one's inferior. And that's simply where they are branching off the brachial. You can see the D2, the superior one, branches first, and then a little bit further on, and then the D3 branches off. And so superior and inferior are fairly easy. They've got the same name otherwise. Now, what's interesting here too is that we then have branches down below from the ulnar and the radial artery, and you can see the several that are here that actually branch in a reverse direction. And I think you can see all the recurrent terms there. Recurrent, recurrent, recurrent. That's referring to the fact that the artery comes out from below and blood is flowing backwards or flowing up